Good evening, everyone. My name is Lambert. I work at the Ahmadu Bello University Teaching Hospital in Zaria. I treat burns patients who have had burns that come to us. And I'm also a burn educator. I educate people about prevention of burns and also prevention of complications on burns. So today we'll be talking about itching. It's one of the most worrying problems that people that have had burns face, usually for about a year or two until probably later in life when it begins to get better. The presentation is just one out of other items that we'll handle today. So I'll be quick and also make it interactive. And at the end, for those who have experiences, I would like one or two persons to share their experiences as it will get to help other survivors. Basically, what we'll be doing today is we'll talk about three major issues around itching. The first is to understand what exactly itching is, especially in burns patients, people who have had burns. We'll also try to find out why exactly people with burns experience this itching and why does it itch so much? Why does it keep happening no matter what we do? The third thing is that we want to know what we can do about it at home and in our various communities. Basically, most of us understand itching as that uncomfortable feeling that just makes you want to scratch. It's not painful, it's just really discomforting and irritating and doesn't let you be yourself. Sometimes you're outside, you're in a meeting, you're at work, and you just have this itch somewhere that you really, really want to scratch. Everybody has it, but it's particularly worse in patients that have had burns. So what we'll try to talk about today, just make you understand that what's happening to you, it's pretty normal when it comes to burns and the things you can do to help you. So basically, as doctors, we call it pruritus, but in simple terms, it's called itching. And what happens is that when there is burns, usually as the burns is healing, the nerves in the body try to send a signal to the brain that there has been an injury and the brain is supposed to feel something. But the problem is that the brain now reads that signal as an itch, and then the body tries to get you to scratch it. Actually, scratching actually feels good, but the reality is that sometimes it can cause more problem and cause more harm than good. So we discuss something called the itch cycle. So usually, this is what happens when wounds are beginning to heal. So those nerves that have been injured, they send a signal to the brain that there is something wrong there, that there are nerve endings that are open. And normally, nerves are supposed to send signals like pain, touch, pressure, temperature, heat or cold. But it doesn't really have a particular definition of what it's sensing. So it just sends it directly to the brain, and what the brain will feel is an itch. And by the time you feel that itch, you now want to scratch. And if you give into the temptation to scratch, you discover that as you scratch, that new skin that is forming over the burn wound begins to break gradually. And then you have more irritation on the skin. And as you scratch, you then discover that more of this signal has come from the nerve, get to the brain, and it continues in this cycle of nuisance that cannot stop. So the more you scratch, the more you keep going around this cycle. So that's exactly what happens during itching. Now, why exactly do burns itch so much? First thing is, as one has gotten burns, the body tries to repair itself. So what it does is that it sends cells, new tissues to the site so that the wound can heal. But the problem is that as new cells and new tissues are coming to the site, they keep irritating the open nerves. And as I told you in the burns, in the nuisance cycle, the nerves keep sending those signals to the brain as itch. And as this healing repeatedly keeps going on, more signals are being sent, and then the itching becomes unbearable. The other reason is that the nerves that were bound to are also trying to grow back. And when they grow back, they try to reconnect to each other. So once they're trying to achieve this reconnection, they begin to send signals to each other. Again, those signals are misinterpreted as itch. So the itching gets worse. The other reason is that when the skin is burnt, normally there are some glands under our skin that are supposed to produce oil, water to lubricate our skin. When the skin gets burnt, those glands also have gotten burnt and cannot produce oil, cannot produce water to lubricate our skin. So the skin becomes dry. And a dry skin breaks easily and causes itching. Then the final reason is that when the body is injured from burns, there's a chemical the body releases called histamine. Now, histamine can be a friendly hormone, or can be a friendly chemical, and can also be unfriendly. It's friendly in that it tries to attack certain things that it does not want there and help us heal. But it's also unfriendly because as it spreads around the body, it causes itching. So the larger the burns, the more histamine is produced and the more itching one will have. Despite this recurrent cycle of itching, there is actually an upside to it. It simply means that from the burn wounds, your skin is healing. So anyone who survives a burn injury or a burns process gets to heal. And that healing process usually is signaled by itching. So that should encourage you that you're on a pathway to achieving healing. And usually, in most cases, it doesn't last forever. If you interact with people who have had burns, who have healed from burns for over 5 to 10 years, most of them will tell you that the itching has improved over time. So it does not last forever. It usually worse in the first few weeks to months after the burns. By 1-2 years, the scar is usually fully formed as long as it's not injured again. It's usually fully formed, and then the itching begins to slow down and get better. So that's usually what happens. So it's something positive. It's something that should get you to be a little more confident and less worried. For itching, what can you do about it? Like I said, it's very tempting, but as much as possible, try not to scratch. The reason is that as you scratch, like I said, the new skin that's forming is very fragile. It's very thin, thinner than a paper. And usually any hard pressure that comes on the skin breaks it. So the more you scratch, the more likely is that new skin that has formed to heal the wound will break. And when it breaks open, the defense against germs and other infection-causing organisms is no longer there. So once the skin breaks, an infection can get in, and then you are going back to where you came from. And when the skin breaks, it has to start again to begin to heal. So because of that, you can begin to have more scars on your body, even more than what was initially supposed to be there. And the final reason is that, like we saw in that itch cycle, the more you scratch, the more signals are sent to your brain, and the more itchy it becomes. So as much as possible, try not to scratch. So what can we really do if you're feeling the strong urge to scratch? You can just gently tap over the scar. Just gently tap it or gently rub it. It provides some temporary soothing, but it is better than outright scratching. So now, remember we said that usually in the burn skin, there are no glands to produce those oils, those water to keep the skin moisturized. So it now falls on you to keep your skin moisturized. And what I think you can use, you can get any moisturizer or an emollient that does not have any perfume or fragrance in it. Now, emollients are just basically, they come as lotions, they come as creams, they come as ointments. And any pharmacy you enter and ask them for emollients, you can actually get them. And what they do is that they try to keep your skin moist. They try to remove any dry, scaly parts and then protect your skin from losing water. Usually, in our local setting, we have some local emollients that people have used and it has worked for them. I'm sure by the end of this discussion, when people share their experiences, you will hear about them. Some use shea butter, what you commonly know as ori. It helps. Some people use coconut oil, very, very good. That worked for many people. Some people use sunflower oil. That may be difficult to get, but some people use it as well. Some emollients that are even being sold, they mix all these things together, shea butter, coconut oil, sunflower oil, and apply. And it really helps with the itching. The other thing that you can actually get is your regular Vaseline. That brand that's actually called Vaseline. The reason is that that brand called Vaseline, I'm not marketing for them though, but it doesn't have perfumes inside, it doesn't have fragrance inside. And those fragrances actually irritate any skin that is trying to heal. So that's why we must try as much as possible to avoid any of these lotions or gels that have fragrance in them. So Vaseline really helps. So as an emollient, as a moisturizer. And it will be good to apply it 2 to 4 times a day. And usually, after you finish taking your baths, you dry your skin a little bit, but not too dry, just a little bit damp. Then you apply it generously over your skin. It tends to help. Then while rubbing it, you don't need to rub it, then to scrub it into your skin to rub it so hard. Just apply it gently, and it will improve the itching. Now it's good to also carry a small tube of this emollient or a small jar of emollients wherever you are going, to your office, your car, wherever. So as soon as you feel that your skin is getting dry, you just apply it, and then you keep your skin moist. Then other things that you can do is when the itch comes is that you can get a cool cloth, not something icy, not something from the fridge, but something that is cool enough to just achieve some relief. So just place that cool or damp cloth on the itchy side, and then to give you some relief. Then also, it's better to bath with lukewarm water, not hot water, because the reason is that when you take hot baths, they get to make your skin dried and then irritated, and then the itch starts and you want to scratch. Also, don't also use extremely cold water. I know the weather is hot, but then you don't need extremely cold water. You just need lukewarm water, because we don't want your skin to be too dry and break. Then for your clothing, it's important to wear clothing that is breathable, not too thick and not too thin. Avoid clothes that are very tight. There are clothes that are made of wool that naturally they even cause itching. Avoid all those kind of clothing, because they irritate your skin. Then it's also important to protect your body from sunlight. If you've been treated in a burns center before, in a place that manages burns, when you are going, they'll tell you to try to protect the burn site, the burn skin from sunlight. If it's on the face, you can wear face caps, you can wear dark shades. If it's on the body, you can wear clothes that can cover your hands, your legs, so that the sunlight will not directly hit it, because the more sun hits that place, the more it dries up, the more it irritates it. And even the heat from the sun too can also damage the skin. The other things you can do is that, yes, like I said, the temptation to scratch is very, very much. And sometimes you will yield to that temptation. Don't beat yourself up about it. Yes, sometimes you get to scratch, but what you can do is to cut your nails as short as possible, so that when you scratch, you don't easily injure your skin. Then, like I said, you just tap your skin instead of scratching. The other thing you can do is also to distract yourself. What are your hobbies? Do you enjoy watching television, watching movies, hanging out with friends, gisting, playing games? Whatever you feel can distract you each at that particular point. It will be of great benefit for you to do that. Also important to hydrate, stay hydrated, drink lots of water. Like I said, Your sweat glands, your sebaceous glands that produce oil and water may have been burnt. So you need to give yourself more water. And again, because the skin that is forming over the burnt areas is not strong enough to keep water trapped, your body tends to lose more water. So go about with a bottle of water, a flask of water, a jar of water, a Stanley cup of water, whatever is easy for you to carry, and drink plenty of water. As much as possible, if you can afford it, put an air conditioner in your room to keep it cool at night. If you cannot, try to live in a place that has a lot of ventilation, good windows, good aeration, because the more there is heat, the more you feel itchy and want to scratch. That's usually the problem. So as much as possible, try to keep your room cool. I know we have problems with power supply and all that, but then you need to keep your windows open for air to come in. Then usually for those scars that are still healing, you can wear compression garments. Usually if you've been to the hospital because of scars or itching before, you see that we recommend certain compression garments to wear that put pressure on the scars. So the more pressure they put on the scars, the more they shrink the scars and the less you have these itching problems. You've done all this and then the itching is still not improving or is getting worse. It's important to see your doctor, visit the hospital, we'll see you, and then we'll try to find you solutions to itching. And if you notice that at any point the burn scars are infected, they are discharging pus, they have a aggressive odor, or you're having a fever, then that means that there's an infection somewhere. Maybe the skin was broken and then an infection has set in. Please see your doctor. Then if there are any open wounds or broken skin also, please try and see your doctor. Then if the itching has become so severe that you cannot sleep, you cannot go about your daily activities, please see your doctor. Generally, when you see a doctor, there are things that we can recommend. So there are medications that generally we can recommend for itching, and some of them you can buy them over the counter. That's, you don't need a prescription to buy them. You can just walk into any pharmacy and buy them. And there are some that you need a prescription for. That's why you need to see your doctor before buying any medication. So one of them are the antihistamines. Now remember I told you that histamine is a chemical that is produced by your body when you have an injury. Burns an injury. So usually we give you these drugs to try to reduce the level of histamines that is produced by your body. So stop itching. You may know some of them like loratadine, Piriton, and the rest of them. Then sometimes when this does not work, we can give you drugs that are steroids. Now, of course, you can't buy steroids over the counter. You must have a prescription to buy them. So what steroids do is that they try to reduce those signals, those irritation that's happening around the nerves and around the skin, to make sure that you don't feel the itch or the itch reduces. Then sometimes we can give you some anesthetic creams that will just make the area numb. These creams, you can rub them over the scars, and then it makes it feel numb, and then you don't feel the itch. But for these ones, you may need to use them over a long period of time. They also have some medications that go directly to block those nerve endings that I told you are firing signals to the brain. So we call them receptor blocking medications. So we can prescribe this for you and then use them. Usually when medications don't work, we've tried the home remedies, they don't work. We've tried medications and they don't work, and the itching keeps getting worse. So we can proceed to surgery to remove the scar. So usually people that have very large itchy scars that have disturbed them for a long time, so they can come to the hospital. We can, through surgery, remove the scars and then put a new skin there, or close up the wound. And usually, most of the times, these people get some lasting relief from surgery But usually surgery is like the last resort when all other measures have failed. So basically, the things to remember from what we've just discussed is that itching after burn is normal. It tells you that your wound is healing. It tells you that your body's trying to repair itself. As much as possible, try to avoid scratching. Gently rub it, tap it. If you're going to yield to the temptation to scratch, please try and keep your nails as short as possible so that the risk of injuring the new skin that is forming will be so much less. And the simple things you do at home, the emollients, moisturization, keeping the environment cool, drinking water, and all that will protecting yourself from the sun will go a long way to reduce itching that you feel. So thank you very much for listening to me. I will take your questions, and I also like you to also share your experiences. There are some things that may have helped you because the area of itching is something that burn doctors, burn surgeons continue to study for a long time and keep developing new things to treat. And for us in Nigeria, for us in West Africa, we've discovered that there are some local things that have helped. Like I mentioned, shea butter. I've seen patients that have used shea butter and it really helped them. So you can also share your experiences of the things you have used that have helped you, and it will help others. But if you have any questions, you can go ahead to ask. Thank you.
Sudoku calling from Zaria. There was a night I had that itching, even the part that were not burnt was also itching me that night. It was terrific. I have to shout and shout and shout before the nurse on duty that night came, attended to me. I think gave me some drugs that night to lessen the itching before I could sleep that night. It happened like twice before I left the hospital. And they say it's a sign of healing. And secondly, after I left the hospital, if you see me today with my pictures when I was in the hospital, you never believe that I had a burn. Just as he described all the situation for healing. I think the burn center in ABU is so perfect. They have a burn center that have ACs, have ventilation, had care, and they have doctors in series that comes to check from all the departments. So we had a lot of care that fasting and healing. I think one that I say that is very key is the environment. You need ACs or fan to cool the environment. The environment is cool, the itching reduces a great deal. Thank you very much for the insightful presentation.
My name is Joy. I had my born last 2024, October 2024. So it's almost 2 years now. My first question is it normal to still feel itchy on those areas where I had burns, even till now? Is it normal to still have those itchiness in areas that were affected? And my second question is also, are they apart from surgery to remove the scars, are there any cream that can be recommended to flatten those scars? Thank you.
All right. Thank you very much, Joy. Great questions. Yeah, glad to see that you are recovering from your burns. And yes, regarding the itching, the thing about the body is that healing continues to go on for a very long time. Healing continues even after many years. Sometimes healing continues throughout a lifetime. So healing really never stops because the body actually attempts to restore what was lost, but does not really achieve it. It can only come close to what was lost, but does not restore exactly what was lost. So the healing process keeps going on. Yes, it is normal for you to feel the itching 2 years, 3 years, 4, 5 years, even after you've had the burns. However, we expect that it should be the intensity or the severity of the itching should be lesser than when you first started healing. So over time, it should get better. It should not get worse or remain the same. So by the time you discover that, okay, after 2 years, instead of getting better, it's getting worse, then something needs to be done. But it's actually normal for you to still feel itching 2 years, 3 years, or even many more years after you've had the bone injuries. Then on your second question about materials or creams to flatten a scar, yes, if you've been in the hospital about your bones, I'm sure you're in the hospital, you will hear doctors talk about things like silicone. Yeah, silicone can come in form of a cream, ointment. It can come in form of a patch, something like a sticker that you just stick on the scar. So what this silicone, either cream or the sticker or the patch does is that it tries to remove the water component of the scar to make it shrink. So that's why we try to tell you, okay, apply it continuously, and it's only when the gum or the sticky part has worn off, you can remove it and then change it. So that's what the silicone does. The cream also does the same thing. Is that for some persons, they respond faster to the patch or to the sticker. So for some persons, they respond faster to the silicone cream or silicone gel. Now, we also use compression garments. So usually, these compression garments can come pre-made. That's they've already made them and packaged them and they sell them. But sometimes you may not find the size that suits you. Or if the bone is on your chest or your back, you may not find one already made to wear on those parts. So there are people who are who know how to design and make these compression clothing or garments for you. So we send it to these people, they take your measurements depending on the area or where the scar is, and then they make it for you. Then you wear it. And just as the name says, compression garment, it compresses the scar also to squeeze out the watery component, also to also squeeze out all those excess cells and to starve them of oxygen to prevent them from growing and prevent the scar from growing. So in that way, it gets to shrink and then reduce the scar.
Thank you very much on that, sir. Though I like for the silicone scar sheet, I've used silicone scar sheets. I've used the silicone gel, like creams. Some of them comes in those scar sheets, but still, to me, they aren't working. And the compression garment I bought, I don't know if it wasn't. I wore it for like a while, but anytime I put it on, the itching becomes so intense, and I don't know, maybe at that moment, I think it's been a while I use this. I have like a compression garment at home, but most time when I put it on, like my hand, because I can't wear on my leg, but when I put it on my hand, the itching becomes so intense. I don't know why.
Oh, sorry about that. So one of the reasons why itching can become intense with compression garments are the material that was used. There are materials that contain wool, fiber, and some other things that could irritate your skin. So the first thing is that the material that was used could be the reason. Secondly, if the weather is hot and you wear those compression garments, it's covering the scars and it's not allowing air, it's not allowing to cool down and all that. You get to have worsening of the itching because of the heat. So usually what we recommend is that you can apply, first of all, apply either a silicone gel or an emollient or just any moisturizer. First of all, apply it before you wear the compression garment. And from time to time, when you remove these garments to take your bath, apply a good layer of moisturizing cream before you wear it. Because the thing is that once you are putting it on, the garment itself can even clean up part of the emollient or moisturizing cream that you have applied. So you need to be generous with it before you wear these garments. And then if that is still getting worse or is not improving, we can also recommend medications for you to take. So it's important for you to attend your follow-ups, make these complaints, and then your doctor looks at it and sees the appropriate medication for you.
My name is Angeline, and even though I don't have a bond myself, I would say I have a little experience. Um, it's funny how Dr. Lambert has explained what we've kind of experienced in the past how many years now. So my husband had a bond. It's with 10 years next year, but he healed, but like he has explained, he's still healing. And when I saw the ad for this session, I was like, I would attend. So I can just understand some of the things that's going on. This itching has been there for a while, from day one, and sometimes it's so intense. He doesn't itch. He has that discipline. He doesn't scratch, but he would kind of tap, tap, tap. He would rub it till he gets some relief and all of that. And we're just discussing while the session was going on that the burn areas have shrinked. They are like the major areas that still had the scar. The size is no longer as big, as obvious as it used to be. And I'm like, how long would it take for it to go completely? So I mean, it's a work in progress, like he has said, and we just trust that in the coming months it would shrink completely. Thank you very much, Doc. Thank you for educating us and opening our eyes to what we are going through and what we can do to make it better. Thank you.
There is a question in the chat box from Balkis. So Balkis is asking that one, does itching occur in all types of burns? And her second question is, what area of the skin are more prone to itching following burns? Okay, great questions. For itching in all types of burns, usually the reason, like I said earlier, the reason why the itching occurs is because skin has been broken. There's an attempt at healing, and then the nerve endings are trying to respond as they should. So most times, virtually all burn injuries that are trying to heal will itch, but the intensity may vary from individual to individual. So two people will not experience the same type of itching. And then again, it also depends on how large the burn wounds are. Somebody who just had a very small burn on his hand or any other part of the body may have very little itching compared to somebody who had a very large burn to his chest. So usually itching will occur during healing for burns generally, but it may not be as severe for everybody. Different people may experience different levels of itching. She also asked about the areas of the skin more prone to itching following burns. Yes, usually the deeper the burns, the more the intensity of the itching. So in burns, we say the outer part of the skin may be injured, then it may go deeper to involve the inner part of the skin, then the very deepest part of the skin. So for people who just had just the outer part of the skin burns, they may experience less itching than those people who had all the layers of the skin burns. And then for burns, for places that are more exposed, we don't wear any clothing on our face. Some people wear short sleeve. Some people don't cover most people don't cover their hands, or we don't wear gloves in Nigeria because our weather is not even that friendly. So areas of the body that the sun is likely to hit when you're going out, your face, your hands, if you're not wearing covered shoes, your feet are more likely to be more itchy than other parts that are covered. Thank you.
I'm a case of burns. This is almost over 10 years since 2016. I had burns from water splash when I had seizure. My case was very well known to Dr. Lambert. So I was attending clinic. The issue came up with severe keloids. The burns is in many places, upper trunk, my upper limbs, and my breast completely. So it got to a stage after administering all the antihistamines, the itching was so severe and the keloid was getting bigger day by day. So it was finally resolved for skin graft. My problem now is it was the itching and getting bigger all the day, the keloids, and now it's still the same thing that I'm experiencing. In fact, the graft site is getting bigger day by day. Upon all the triamcinolone injection, the silicone sheets, the jackets, the compression garments, I don't know. I'm still on antihistamines anyway with the injections that I was getting so complicated with severe atrial bleeding. Up to now, I couldn't get any remedy that will ease my itching, despite the typing that they said one has to, as a matter of fact, in other times, you won't even know when the itching will come and you start scratching. In fact, sometimes I even go about with comb to scratch because hand cannot only do it. So I don't know if there's other remedy one can use apart from, I even go to extent of using some herbals, like all these black seeds, castor oil, just for it to ease the itching. I'm still battling with the itching and the keloids been coming back again despite the surgery done.
Sorry, Aisha, for the symptoms you've been having. Must be really, really difficult. And we commend you for your courage to keep going. There are a lot of times that everything that has been done may not work. Because like I said, just as our faces are different, our bodies are different, and our bodies respond differently to different things. So research has continued into solutions for itching, because your case is similar to a whole lot of more other cases that everything has been done, yet it still continues. I think I remember you tried something on ultrasound too, because there's a treatment that people have tried where the physiotherapists use ultrasound waves to shoot or to apply to the scar to reduce the itching. It helps some people, it doesn't help some people, and people keep trying things. Aisha, what I will advise is that you come see your doctors, you come see us so we can brainstorm and then take a look at you and then see what further we can do. The fact that it's not responding to conventional things that we've done doesn't mean we have to stop trying. And like I said, the healing in the body continues for a very long time, sometimes a lifetime. It continues. So keep exploring options and treatments, alternatives for you until we're able to see how we can get you to feel better. So sorry about what you're going through.
And I want to thank Doctor for enlightening us more on this and on this topic. We appreciate his commitment and his willingness to join us today. At least he has impacted in our lives, and we'll be able to share this out to other survivors. Thank you very much, Doctor.